This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Dr. Seidel, you take it away.
Yeah, that looks great, Corey. Thank you. So I'm Dr. Seidel. I'm the program director. You can all hear me okay? Thumbs up. Yay. Okay, good. Welcome to San Antonio virtually. As was mentioned before, I am Dr. Seidel. I am the newer program director here at the UT Health San Antonio. Next slide, please. Ooh, we got a nice illusion in there. So you can see here's our most recent photo taken a couple of weeks ago of our 32 member residency program, including our faculty as well. So there's a few more than 32 here. It was nice and warm on that graduation day. And
I have my
I think it froze for me. There you go. All right, so I am the program director, as I said, at the, I primarily focus on brain injury and electrodiagnosis and a little bit of OMT. I work primarily for the VA clinically. Dr. Monica Gutierrez, you may have heard of her before. She is our department chair, also very involved with the residency program. Her interests are in spasticity management, brain injury, long COVID. We now have two associate program directors. Dr. Raghunandan was our associate program director before I even started as program director. He does interventional MSK and spine. And this year we also added Maria Polifran, who is brain injury medicine and our consult attending at the University Hospital. Next slide. So I think the crux of what I'm going to discuss today is trying to imbue on you this growth mindset that we have here in San Antonio. So we just opened a new 12-story, 300-bed women and children's hospital. It was a $500 million project. It has a pediatric rehabilitation gym. We have new faculty that we're onboarding. We have 3 new faculty starting in the fall, TBI, sports, pain, spinal cord. So there's a ton of opportunities in this particular city and within our 3 primary sites, as we will discuss. I think Dr. Hayes is going to talk about it, but we have University Hospital, we have UT, we have the VA, so we have a number of different clinical sites, and there's expansion and growth mindset in all 3 of those institutions. Next slide. So this December, we have a new multi-specialty and research hospital called the MSRH that's opening. We're hoping to expand more of our cancer rehabilitation and develop a new cancer rehabilitation rotation. Dedicated research space. There's MSK and spine interventions, a lot of opportunities to see some really interesting patients there too. So within the span of the past couple of years, you're already seeing that we have multiple brand new hospitals in this huge hospital location, and you'll hear more from that from Dr. Hayes. So as I said before, we have three major veins that we include in our program. So one of them is UT Health, which includes our MARC, our MAZE, and our dedicated spine center. That's where a lot of the cancer rehabilitation is being built. I myself work at Audie Murphy, which is it's a VA facility. It's one of the only 5 designated polytrauma centers in the United States, and therefore has extensive brain injury rehabilitation services where we see disorders of consciousness patients all the way through the mild TBI. So we see the entire spectrum of care along the VA, and we have a close connection with the military hospital, which sees international brain injuries in an acute setting. So great opportunities there. And then University Health is where the medical student school is also housed. And we are thinking about a number of different fellowship developments. And as I said, that's where the new Women and Children's Hospital is also housed. So lots of great things happening here. That's the bottom line. Next slide. All right, passing off the mic.
All right, so hey, Corey Hayes here, PGY3. So these are all of our training locations. It's not all encompassing, but it's the main ones. Dr. Seidel already kind of touched upon everything. A little bit of where we also work at Warm Springs. Our clinics recently had a transition from University Hospital, like one of their facilities, to Warm Springs Rehab. It's a private institution, and we have an inpatient month there. We also have all of our clinics there. The SAMC there on the bottom, that's the largest military hospital in the US, and you get to see a lot of cool pathology there. I got to see some really cool stuff, and I'm sure a lot of other people in the program have seen really great things there as well. Texas Center for Athletes, that's over there. It's on like Spurs Lane is what we call it. They used to be the doctors for the Spurs, but UT Health won that contract, and so now UT Health is now the sports medicine physicians and surgeons for the Spurs. They also kind of cover UTSA athletics, so you get to see a mix if you're interested in sports, of collegiate and professional sports if you'd like. So it's a great place to be at for that. So this is the point of this slide is to show you how close everything is. Generally speaking, everything's within a couple of miles of itself. These are all the main places that we usually rotate at, spend like 90% of our time plus. There are a couple of places that are a little bit further away. Mostly it's BAMC or SAMC rather. But even then, at most, it's maybe like a 45-minute drive with traffic, kind of like in the middle of the day. If you're going in the morning and you're usually, then it's going to be like 23 minutes. So everything is very close. There's a lot of stuff around you. You got a lot of close proximity there. So we are a true categorical program. We have an intern year that's kind of aimed at seeing aspects of medicine that's relevant to PM&R. So we have 5 months inpatient, so we get a very robust inpatient training. They're all, very good months, 2 months of ICU, 3 months of inpatient medicine. And the rest of the year is kind of 6 months of like clinical setting, right? So we get ortho, 3 months of ortho. It's very good for working on, musculoskeletal interventions and things like that. Neuro, rheumatology, very relevant to PM&R. Palliative geriatrics, again, relevant. And then the 1 month of PM&R, we have a PM&R consults. It kind of gets us a little bit acclimated to the Epic system that we use a lot when we're on our inpatient rotation. And I think a really nice part of this program is that interns are part of the program, like from day one. We see them, some interns 2 times at each didactic day, other interns just on Fridays. But if you're not on inpatient month, you're coming to didactics, everybody's texting everybody. If you need any questions or need any help, we're all literally, obviously in the same system. So it's very easy to get help. It's very easy to be a part of the community. Continuity of training. Yeah, building relationships with consult services. It's kind of, you really get to see and grow with the people you work with on your inpatient medicine months, like kind of burgeon into their own field and stuff like that. You can ask them questions. A lot of times they ask us questions about stuff, kind of like curbside. It's really nice to see as you kind of go through it. Our mentorship program, we call them families, but you're basically, when you come in, you're paired up with a PGY3, and there's a PGY4 and a PGY2 who were the previous PGY3 and 1. And so we're all part of a family. We get together, we should get together, and we just kind of hang out, talk about things. It's sort of off the books, so to speak. It's just really like camaraderie, building those relationships. And the intern welcome retreat, we have a day right before intern year starts where everybody goes to like a team building activity. You know, we'll have a little bit of food. It'll be at someone's house. It'll be at some sort of facility or like a park or whatever. We do team building exercises, little competitions, and it's really a lot of fun. Everybody really likes that. Here we have our interns. They are right there. Everybody, we're missing Lauren. Lauren is not in this picture. You'll see her in the next one there. But we have a great group of interns. They're eager. You know, they do a great job. They're starting off strong. Here's a full list. You can catch that picture on Instagram there. Let's see. So PGY is years 2 through 4. You do a lot of inpatient rehab. We recently just had our schedule changed from doing like 4 months rather, of our inpatient unit to just doing 3 as a second year and kind of having that more spaced out with the goal of giving people an opportunity to have more like specialized like outpatient clinic exposure. So you can see like we have TBI, spinal cord, peds, pain. That was a big one. You know, if someone is interested in pain or sports, they have an opportunity now second year to kind of see that earlier rather than having to wait till third year, which is kind of like what my class is doing. So that also alludes to how receptive our program is of kind of changing things, because that happened like from one year to the next. And so our program overall is very receptive to feedback. And if it's reasonable and if it's attainable, you know, we'll do that, especially with Dr. Seidel at the helm. I mean, like, you know, the sky's the limit. So we can definitely, if there's something that needs to be changed, it's going to be changed, especially if it's for the betterment of the program. So our inpatient rotations look kind of like a full-fledged, you know, primary service inpatient rehab rotation. That's right. That's like 4 months. Second year, well, it was 4 months. Second year, now it's 3 months. It's a very good experience. It's hard. It's a lot of work. You're there early. You're there late. You get a lot of admits, a lot of discharges, but you become a very good, robust inpatient physiatrist. You're doing medicine a lot of the time. Polytrauma, like Dr. Seidel was saying, 1 out of 5 in the country. Get to see a lot of cool pathology there. P-TRIP, we don't really rotate too much at P-TRIP, which is the transitional rehab program, but that's an option if you want to check that out. Our spinal cord injury unit, that's very fun. Dr. Burrow is very knowledgeable, and he's the attending there. And then there's 4 weeks currently of electives built into the schedule. I think we're vying to get a little bit more, but that is one thing that I, you know, think that we're going to keep working on there. And you can kind of see what our opportunities are. We have a full spectrum of opportunities. So procedures, we get a lot of procedures. I mean, I was mentioning earlier, we have 3 months of orthopedic outpatient clinic, and when I was done with that, I had, you know, somewhere in the realm of 90 something peripheral joint injections. They weren't all ultrasound guided, I will say, but it was a great experience, kind of learning how to use a needle, talking to your patients, drawing up the medications, those sorts of things, and really getting in a good like orthopedic musculoskeletal assessment there. As far as EMGs goes, we blow the requirement out of the water. And we have Dr. Dimitru and a lot of good faculty who are very good at EMGs, but Dr. Dimitru basically wrote the book. You know, he's the guru of EMGs, so to speak. And then as you can see, there's a lot of other injections and procedures that we get to do, a lot of cool pain stuff. Dr. Gutierrez, who was our chair, she's basically the head honcho for spasticity. She wrote the book. She's rewriting the book. And so you get to work with her and you just see how she does things, and you really get a lot of good learning, a lot of good procedures. So our call schedule, it's very nice. The perk of being in a larger rehab program is the call schedule is not as taxing as it can be in smaller programs. So you have no call PGY1 every 5 days on your inpatient medicine rotation. You'll have like a late day, which is your call then, but otherwise none. PGY2, you have 12 to 13, 24-hour Saturday or Sunday shifts. PGY3, 6 to 7 Friday evening shifts, and you're on backup. Backup call is just being there in case someone is sick, or if someone has a question or there's an emergency, you know, you can help them out. And then PGY4, it's just backup. You don't have to go in. It is very nice. That, again, huge perk of being in a large rehab program. So night float, we do night float during our Reeves inpatient rotation. It's Monday through Thursday. You hand off on Friday, and so you basically get the rest of that day off. But what you do, there's no rounding or anything like that. You come in, if there's any patients that you need to see or admit, you see them, but otherwise you just have the pager for all 3 of the services, polytrauma, spinal cord, and Reeves rehab, and you're just the doc on call for it. It teaches you a lot of responsibility. You get really used to making decisions, and it gives you some autonomy without I guess, jeopardizing patient safety, because you always have your attending, and I've had to call my attending in the middle of the night for an emergency, and they answer and they're very helpful. So it gives you a good feeling of autonomy. So that's how we do our night flow. Our didactics, mentioned that a little bit earlier. We have 2 hours Thursday and Friday in the morning. It's protected time. The pagers and the phones go to the attendings at that point. So we have weekly assignments and case reviews, not necessarily like case reviews and assignments, but we do have a weekly question with each schedule that we get. Sometimes we'll do case reviews or M&Ms if it happens. We're trying to implement more oral board prep, at least like now. Again, it goes to like the adaptability of the program. One of our attendings is trying to get our fourth years to sign up. Well, they will have our fourth year sign up for oral board prep, which is another good thing that we're trying to do. We have journal club, various attendings, and with their expertise will come and talk to us and go over a journal. That's very high yield, or sometimes not very high yield, just to kind of analyze it and just get your mind thinking from a research perspective. We usually, I think roughly the way our academic chief is doing it currently, we have one lecture a year that we're supposed to give, and a lot of times it'll be like faculty who are giving their PowerPoints on their field. So it's very nice there. Our ultrasound workshops and ultrasound club, that is what I think has changed a lot recently, and I've seen it, and it is for the best. You want to be good at ultrasound, and so about once a month we'll have like a specific joint or musculoskeletal ultrasound session during our didactics, 2 hours. We have a large room with a bunch of machines, and we just ultrasound each other, and it's really awesome. And then to follow that kind of in like a spaced repetition type of thing, we have an ultrasound club. So about a month or so afterwards, we have our ultrasound club. It's like one evening a month, an hour and a half, and we just kind of go over a certain topic. And it's really good to kind of hammer that in, because you need a lot of reps to get good at that. Research. Again, it's a large academic institution. There's no shortage of research. Our research chief does a good job of finding projects for people to get on. And if you want to get on something, you can. I mean, I was a med student here at UTSA, and I was able to get on a project with Dr. Olasanya. I don't know if you can see my cursor there, but I was able as a med student to get on a paper with him. And, we have our research day. That's a lot of fun. PT, OT, and speech, sometimes neurosurgery. It's very interdisciplinary, a reflection of the specialty, at large. We all get together and kind of discuss things. We're going to have a keynote speaker we have a keynote speaker at each one. Last one was Dr. Cucurullo, very impressive there. And so it's a very good time there. And then as far as like opportunities to present at conferences and things, everybody's looking to publish and get something sent to a conference, whether it's a presentation or a paper. And so there's no shortage of that. If you want to do it and you want to, dedicate time to it, you can really do that. So a lot of opportunities there. And so what I'll do now is I'll hand it off to Dr. Cicconetti. He's going to talk about kind of like resident life and just kind of like the pulse of the program if he's there.
Yeah, I'm only going to be on for a brief time, but hey everyone, I'm Sam Cicconetti. I'm a PGY 2, fresh out of intern year. So if anyone has any questions about intern year life, just let me know. I'd be happy to answer those questions. So in terms of, community involvement, we have multiple opportunities for sports physicals and events. I'm actually signed up to go to one next weekend. We're doing free high school physicals for local student athletes. Project Mend, which is it's a company that basically it's like a charity for people with disabilities, or if they have like medical equipment in terms of like wheelchairs that we get involved with. You can see the picture there in the bottom. I haven't been a part of it, so I actually don't know exactly what it's like, but I've heard very good things about it. And then Food Bank, other organizations. I know there's opportunities for adaptive sports like Dock Pirates and other opportunities kind of within that realm. You can skip the next page.
I'll add to that. On our inpatient rehab rotation, we're a county hospital, so we get a lot of unfunded patients, and we use Project Mend to give them their DME needs. So a lot of times people will come, they won't have any insurance, they'll be unfunded, and they'll need a walker, they'll need a tub transfer bench, they'll need a sliding board, whatever it is that they need. Project Mend refurbishes these articles and makes sure they're up to standard to at least give to the patient or give at a discounted rate. So it's very nice.
And sorry to interrupt, I did a later start, so I'll just give a 2-minute warning.
Okay.
Thank you.
Got it. Thank you. I'll be stealthy. All right, resident friendly, yes, definitely much so. So every month during our didactics, we have a monthly town hall. We had one today, just to check in with our chiefs, from our program director as well, Dr. Seidel. He comes in, checks in with us. We have there's plenty of opportunities for parking access at the main hospital and all the satellite sites. We have a mentorship program, which Corey talked a little bit about earlier, both with faculty and other residents. Corey's actually one of my mentors, so we've been hanging out quite a bit. Good time. And then Dr. Platform, one of the assistant program directors, is my faculty mentor. Monthly social events, and then intern welcome retreat. I'm actually at one of the other residents' apartments right now for a little social event. I'm just in his guest room for this, but we hang out, we have a good time. You can go to the pictures, which we'll speed through. Just some photos of us floating the river, other sorts of volunteer opportunities. Life in San Antonio, it's a pretty low cost of living. I mean, even with inflation, it's doable. Housing, I don't own a house. I have an apartment. There are multiple areas to live, whether if you want to be kind of in the downtown area, which is where I am, by the Riverwalk, you can do that. If you want to be a little bit more away, have a little bit more, I guess, space and quiet, then you can also do that. Beach food, winters, I wouldn't even call it a winter. I mean, I'm from Cleveland, Ohio, so it's like, it's not even winter. And then a good job, Mark.
From Massachusetts, Sam. I win.
Yeah, yeah. You
All
can
right, I
take
think
over,
that's
Dr.
it.
Seidel.
So everybody, we have great graduation stuff. If you have any questions about our program, feel free to reach out to any of us. I'm sure we're more than happy to answer some questions. Dr. Luke Lehman, who is our admin chief, wasn't here tonight, but I'm sure he'd be more than happy to also answer some questions as well. He's all of our emails are on there. It's great. Thank you all. Thanks for listening.
Perfect. Thank you so much. And feel free, please, if you'd like to field any questions in chat. But thank you so much.